We interrupt your normally scheduled program to bring you this breaking medical alert. I'm Paul Polio with my co-host Peggy Paralysis, and we're here to talk to you about Ebola.
Ebola, the host range for and other primates. Ebola's host specificity are endothelial cells, liver cells, and several types of immune cells, and also dendritic cells.
Ebola is a hemorrhagic fever. It is a rare and deadly disease caused by infection with one of the Ebola virus strains. Ebola can be transmitted through bodily fluids.
Some signs and symptoms include influenza-like symptoms. Vomiting, abdominal pain, shortness of breath, chest pains may occur. Swelling, headaches, and confusion. Yeah, like that. Some cases, internal and external bleeding may occur.
Yeah.
The average fatality rate is around 50%. Case fatality rates have varied from 25 to 90 in past outbreaks.
Some more scary news. Total cases, suspected, probable, and confirmed, range between around 24,962. Laboratory confirmed cases, 14,745. Total deaths, 10,353. So,
Sorry, Paul, but there are currently no licensed Ebola vaccines, but 2 potential candidates are undergoing evaluation.
So, if there aren't any vaccines, how can people protect themselves from Ebola?
Well, you can practice careful hygiene. Avoid objects, places, and people who have come in contact with this virus, including medical objects. If coming in contact with a potential infected people or animals, make sure you wear protective clothing. I don't have it, Paul.
Are you sure?
I'm sure.
Alright.
Anyway, community engagement is key to successfully controlling the outbreaks. Good outbreak control relies on applying a package of interventions, namely case management, surveillance and contact tracing, a good laboratory service, safe burial, and social mobilization.
Our nerds on staff tell me that there are some treatments. Let's see what we have here. These treatments include providing IVs and balancing electrolytes, maintaining oxygen status and blood pressure also, treating other infections that occur as it attacks the immune system, you are prone to secondary infections, early supportive care with rehydration, symptomatic treatment, also improves survival.
So we interviewed a couple brave citizens about their knowledge of Ebola, and this is what we found that they knew.
Go ahead.
Ms. Calderon, do you know what this is?
No.
Have you ever heard of the Ebola virus?
I have on the news, but do you want to tell me more?
Mr. Aronson, do you know what this is?
By look? No. But I have a suspicion.
What's your suspicion?
Mono?
No.
Oh! Okay, no, I have no idea.
Have you ever heard of the Ebola virus?
Yes.
Well, this is our model of the Ebola virus. Do you know anything
Very nice,
about
by the way.
Ebola?
Do I know anything about it? Not so much.
Ebola is a hemorrhagic fever. It's a rare and deadly disease caused by an infection of one of the Ebola virus strands. Ebola is caused by an infection with a virus of the family Filoviridae, genus Ebola virus. Ebola was first discovered in 1976 near the Ebola River in what is now the Democratic Republic of Congo. Since then, outbreaks have appeared sporadically in Africa. The natural reservoir host of Ebola virus remains unknown. However, on the basis of evidence and the nature of similar viruses, researchers believe that the virus is animal-borne and that bats are the most likely reservoir, and it is transmitted through bodily fluid.
Do you know if there's a vaccine for Ebola?
No, but there might be a treatment. Is there a vaccine?
No, but
If there is, I want it. I would guess not.
There are test drugs that they're currently giving to some people, but they're not being regulated or mass produced yet. Do you know anything on this replica?
No.
Any parts? Oh, do you want to explain that? So, can you name any parts on anything like this?
Yes.
You know?
Beans, pipe cleaners, No, what is this?
Okay.
I got flustered last time.
These are like the little feet of Ebolas where they attach to your.
Helps it
replicate it, yeah. And then this is the capsid, which encloses the RNA inside of it.
Awesome. Well, thanks for teaching me more about it.
You're welcome.
Spread awareness. It's the closest I ever get to that Ebola virus.
So, how can people learn more about this virus?
Well, to learn more, you can visit the CDC website, or you can visit your local doctor and ask them if you are at risk for Ebola.
Thanks, Paul.
No problem. I'm Paul Polio.
And I'm Peggy Brownson. Make it a great day to be a Viking and be safe, everybody.